Okay, good morning. Let's talk briefly about tuber disease. So, tuber disease are diseases that affect the tube of a woman. We have the womb, then the womb also has the tubes. Then we also have a tube that carries the egg, ovarian ligament. All right, and then we have some other ligament that suspend the uterus. All right, see this picture. This is the egg and this is the tube. Now, when you have the tube that is blocked, there are various reasons that can block the tube. Number one on the list is an infection. For people who have been having recurrent pelvic inflammatory diseases, you have been having history of vaginal discharges, maybe you have had gonorrhea, you have had chlamydia infections, you have had all manner of STDs, you can come down with a tuber disease. Okay, and then you can have a blockage somewhere. It can also follow surgeries for those who have had. So for those who have had D&C, especially if you had it severally, or you had it in such a way that is not hygienic, or you just did it with someone, a quack, and you know that in Nigeria, abortion is actually not allowed, it's not legalized. It's only in certain instances what we call restrictive abortion law exists in the country. So a number of people therefore go to people who don't even know enough to take care of them, and then from there they get many infections that eventually affect their tube. Some people have had surgery for other reasons, but because of additions and healing and fibrosis, the tube can get affected. All right, for example, for those who have had surgery around their womb for fibroid, those who have had surgery around the tube for ectopic pregnancy, or they have had tuber surgery before, or they have some infections around the pelvis that is not even related to the uterus or the reproductive organ, they can also have tuber blockage. All right, some people have it as a result of the drugs they are taking, abuse of alcohol, abuse of smoking, are you getting me, and marijuana and many other things have been adduced to causing a tuber disease. Most times when you have a tuber disease, you will be told that we don't have much to do about it, but that's not true. Yes, while it is easy to go for IVF, but a number of things have also been done in order to improve on how much success you have when you have a tuber disease. All right, it appears IVF is high on the list, no doubt about that. But there have been surgery that have been done to flush those tubes. There have been surgery to create new opening on those tubes. There are surgeries that can separate the distal edges of the tube, especially when they are very close to the ovary, what we call femoral surgery and all that. Those have been tried to some level of success. Some people do this surgery using the minimal access surgery, like laparoscopy, and some will actually go for open surgery. All right, these are things that have been done and has given us certain degrees of successes. But if you're looking for what is certain and is reproducible, we will say that you should go for an IVF. But it doesn't mean that there are no other things that we do to control or treat situations of tuber blockage. All right, so but for those of you who have one tube functional, you don't need to worry about it. If there is a delay causing delay for you, it is not because of tuber problem, because for you to have a tuber problem, you must have problem on the two tubes. So if one tube is set to be open, congratulations, you have passed the test of tuber patency. All right, that means you can become pregnant. If there are other things that are causing delay, then you need to talk to a gynecologist who will help you to fish them out and address them, and then you'll become a mother. I hope this helps. Thank you.